evening and many thanks for watching KT and welcome yet again to this edition of Health and Wellness, where we keep on saying that your health is your wealth. Today we want to talk about how you can have that picture beautiful smile. But how exactly do we take care of our oral health and protecting our enome? To have this discussion with us is Dr. Kelly SM, who is an animal dentistry specialist. Karibu sana.
Thank you.
Yeah.
Thanks for having
me. So we have, I want to have a beautiful smile as yours, Okay. And many of the time, you want to take a perfect photo for your Instagram, you're asked to smile.
Yes.
It's a tradition.
Yeah.
But unfortunately, it's usually not the case for everybody. So just take us through, first question, how do we take care of our teeth?
How do we take care of our teeth? This is like a lifelong thing. So first of all, before we get to the teeth part, because what we need to appreciate is oral health is it's a broad thing. Yeah, it's not just how your teeth look like. So we say oral health requires of you to be able to chew, to function. So you smile, of course, and express a wide range of facial expressions without any discomfort and without feeling like you cannot do it. Okay, so this basically entails the well-being of not only your teeth, but also your muscles, the skeleton, so everything head and neck. Yeah. Then now we can talk about how to take care of it.
So if I'm unable to, because most of the time people think that a healthy tooth or healthy teeth are those that are white. Those that are not infected. But I hear you speak in terms of you should be able to chew, you should be able to express facial expressions, and you should be able to do that free of pain.
Yes.
Yeah?
Yes.
So now tell us about teeth.
About teeth. So, of course, I am very passionate about oral health because I'm a dentist.
Yeah.
And I guess oral health awareness is what I am very focused on, especially in Kenya, because most people are not aware and people are making decisions without fully understanding the implications of the same. The same way you've pointed out that most people think just because your teeth are white, it means they are healthy. But is that really true?
Tell us.
Not really. Teeth are complex. The first thing we need to appreciate is your teeth are not separate entities. They are connected to the rest of your body. We've always been campaigning. There's a slogan under the International Dental Organization, FDI. We normally say healthy mouth, healthy body, healthy mouth. They are related. Yeah. So you have to make sure that you have good oral health wholesomely. Okay. So taking care of your teeth begins from very early. Your teeth begin forming from the time you're in your mother's womb, about 8 weeks. That's when your teeth start forming. So your mom actually plays a big role. Side chat, happy Mother's Day to all mothers. Yeah. So your teeth start forming at that point. 8 weeks intrauterine, your teeth have started forming, the baby teeth, and teeth will continue forming up until you're around 12 to 14 years of age. So the formation period is also very important in terms of well-being. I think most people, there was this whole thing online where people were talking about discolored teeth, and someone was saying that they feel marginalized because their teeth are discolored. And people make fun of it. There was a time people are making fun of it, but it's actually something that's very serious, and it puts people down in terms of self-esteem. But this is something that happened when the teeth were forming.
Wait, because now we're talking about teeth forming at 2 months.
Yes, intrauterine.
Right?
Yes.
So here is a point where we're not even done with the first trimester.
We are not
but
done.
Your teeth have started forming. Now tell us how that gets to affect the future person.
Yeah. Okay. So as a mother, at this point, whatever you're eating plays a big role. Whichever water you're consuming plays a big role towards development of your child's teeth. Your child can develop dental fluorosis, affect their baby teeth because of you exposing yourself to a very high fluoride content. The water that we are taking, it is not only drinking water. When you're making rice, you're using water. When you're making ugali, you're using water. Anything you're ingesting, that is fluoride level. And right now we have a very serious campaign against fluorosis in Kenya because this is something that we can prevent. So we are raising awareness that every person should know that ingested water has a limit in terms of fluoride content. And fluoride is not salt. So you cannot say that this water is salty, so it has fluoride, or this water is not salty, so it doesn't have fluoride. Salt is sodium chloride. It is chloride, not fluoride.
Yes.
fluoride is a very tiny element, a very tiny ion. So even if you use those filtration systems that are not designed for fluoride ions, they don't work. Water can look clean, but it still has fluoride, a high content of it. So it's important that we measure the fluoride levels. Because I am here, of course, I'm going to be asking that there be policies put in place where if you're providing water, if you're putting up an apartment or you're setting up a house, test that water. When you're moving into an apartment, tell them, I want to see the composition of the water. It only costs like 1,500 shillings to take it for testing. And you protect your child from a lifelong of suffering, because the discoloration comes with also other factors, okay? So at this point, I think I've mentioned that the most important thing is whatever you're ingesting as a mother. And this will also play a role when the child is born, and whatever they're eating up until they're around 14 years, playing a role towards development is whatever you're eating.
You know, Doc, you've mentioned something that I think many do not know in terms of the composition of water and what lies therein that affects teeth, you know, because every household in Kenya knows if you want to treat water, what do? Pour chlorine.
Oh, yeah.
And you're done, you know? You go to, like Nairobi as we speak today, a lot of apartments are coming up and all you're seeing is it's borehole water. And that borehole water is just pumped straight to tanks and into houses. So are we looking at a situation where, due to unavailability of lack of policy or lack of implementation of policy, if there is any, that many Kenyans today are exposed to water that has high fluoride content in it?
Yes, that is exactly the case. No policies have been put in place. There's no regulation. People are not aware. So people are ignorant. So you get your child, you've been thinking you're consuming safe water. Because for us, I think as oral health providers, when we talk about safe drinking water, it's not only about the microbacteria, the microorganisms or whatever. We also want safe fluoride levels. So if policies are not in place to regulate that, then people are going scotch-free. And now as a parent, you're suffering because your kid develops fluorosis and you're like, we don't live in Nakuru. There was that whole thing of only people in Nakuru. But now it's not that. Kenya has high fluoride reservoirs. So you sink a borehole, you're there. We're seeing it a lot also in Syokimau, in Athi River. So many places. Kileleshwa. It's bad. It's bad. So policies need to be put in place. There is a filtration system that can give you safe drinking water. If we are not able to, I know because sometimes getting these policies takes a bit of time, but as consumers of this water, you can make a decision to install a filter in your home and educate the people in your household. Let the caregivers know, let the children know that water that you're going to use for drinking or ingesting, if you're cooking, there is a safe tap. That tap will produce safe drinking water. So you can put like a whole system of filters in your house. And these are things that you can, because I know most people in Nairobi are probably renting. If you're renting, I know there's that concern of why am I putting for them? You can remove them when you're done and you can carry them. Yeah, and you have safe water. But we have to push for policy.
Am I hearing you, it's a safe place. Am I hearing you say that in terms of oral protection and oral health, right, that the water we are consuming is not safe on that fact? Because oral health is not only about microorganisms, like you said, it's everything else. So how bad is the situation in terms of unsafe water that we are consuming? Case in point, Nairobi.
From my practice, what I've seen and also what my colleagues are reporting, the situation is bad, honestly. You're seeing from, let's say, a pool of 10 children who come into your practice, about 8 of them have fluorosis. That's a high number. That's a high number. And this is why we are now starting to talk about it, because we can actually change that. We can prevent the fluorosis. Yeah.
Doc, I see we have a lot of equipment and paraphernalia.
Yeah, a lot.
So here's a question where I've already taken the water that has high content of fluorosis in it. Is just brushing my teeth enough? if I brush my teeth after every meal, because that's what we do, after every meal, brush your teeth, but not whenever you drink water. When you drink water, you don't brush your teeth. Can we treat that by just brushing your teeth?
Unfortunately, no. And this is why we're very loud about policy. Fluorosis is an intrinsic issue. It affects the tooth during development. How I like to simply explain it is you're trying to stack blocks, but between these blocks, there's some little particles that are trying to come in there. So as the tooth is trying to form, these fluoride ions are basically making the structure of the tooth very irregular. That means the tooth structure has been messed up already during formation. So even if you brush, that doesn't take it away. The fluorosis has happened, it has already happened. However, if it doesn't happen, we need to brush well. Yeah, but with fluorosis, that's an intrinsic thing. The treatment options are, we normally say it's more of a masking philosophy or hiding the damage that has already happened. So you will hear solutions such as masking, where we are putting fillings on the top surface of the teeth. So let me just show you how a tooth would look like on the inside, yeah? So a tooth has the outer layer, the enamel, the inside layer, the dentine, and then the most inside one, the pulp. This outside layer, the enamel, is the part that's normally affected by the fluoride, okay? So when you're coming to us, when you have fluorosis, because the tooth has been affected through and through, we can only hide. So we can reduce the tooth structure from the top and place, it's like a curtain. Yeah, to kind of like protect and make the teeth look better. For some cases that are very severe, we can do crowns. A crown is something like this, yeah? So the tooth is reduced, yeah? Sort of like that, yeah? Then it gets a cap over it. So that's a crown. So these are solutions that are meant to try and mitigate some challenges that come along with the fluorosis. I'm sorry, with fluorosis, I can take the whole day because I honestly feel like if people are aware, they can prevent it. These solutions are not cheap. They are not cheap. Getting masking, getting crowns is not a cheap option. So it's always best to just prevent.
Look, you know, I'm coming from a point where we see a lot of advertising out there, especially from a specific segment, especially those who say they have indigenous knowledge or daktari wa mitishamba who say they can treat that problem, right? So you find that someone who has had fluorosis for a very long time, they're advertising that when you go, they will apply some chemical and the teeth will be as white as they can be. Is that a lie?
It's a lie. It's a lie. I have seen some of that content online, and unfortunately what they are trying to do is abrade the enamel. You're doing abrasion. So we have said that fluorosis is affecting this outer layer.
Yeah.
So these chemical agents that they are trying to push into the market is basically removing the top part of the enamel. Remember, the closer you get to this central part, there's effects. You're going to feel like your teeth are sensitive. There's nerves inside your teeth. Your teeth are alive, by the way.
Yeah.
Your teeth are vital. They have nerve endings. They have blood vessels. So you're removing this protective layer. Enamel is literally the hardest structure in your body. But these people have now devised a way where they can scrub the enamel off so it appears white because this outer layer has had staining. So someone would think that's a simple solution. It's cheap, it's easy, I can get that done. But long term, what are we looking at? We are looking at somebody suffering from decay because they don't have the protective layer. We're looking at somebody suffering from long-term hypersensitivity, that feeling where you cannot eat ice cream, you cannot take hot tea. Imagine not being able to take hot tea. Imagine. It's a problem.
Yeah.
So we are really trying to raise awareness, but these people are really trying to push that. We have to look at the science behind it. And that is what I think I keep telling all my patients. Before you make a decision for any treatment, tell me the science behind it. Before I offer you any treatment, I want you to understand why I'm doing what I'm doing for you. So the science behind it is the problem. Those things are not safe. They're not safe.
You know, you've just let down a lot of people out there, but I think it's information that many need to know because I think when you talk about dental fluorosis, but then again, there is also discoloration of the teeth. Those are different things. You can tell us about it.
Yeah.
So if it's dental discoloration, that is something that can be cleaned off by a dentist, right?
Yes.
But is not the same thing as removing the enamel coat.
Yes.
Those are different situations.
So
take us through what is a healthy tooth and what is not healthy and the solutions that are there.
And the solutions, okay. So let me start with the staining part because we focused a lot on fluorosis.
Yes.
Fluorosis is just an example of a situation where your tooth has developed an intrinsic discoloration. So the tooth is discolored because of an inside issue, through and through. So the tooth has a problem through and through. So these things that we are doing, we are just trying to hide the issue.
Yeah.
But a tooth can also get discolored as a result of exposure to staining agents.
Okay.
What are these staining
Coffee.
agents? Yes, thank you very much. We all love coffee, but coffee is high on the list. The most healthy, unfortunately, substances that we eat, anything that has like a lot of iron is also very heavily staining. Kienyeji mboga, especially spinach, liver, all those yummy things. If you have a lot of iron in food, it tends to be very heavily staining, very green mbogas, those kinds of things. We have snacks, soda. What are these things that children like eating? Are they called?
They call them waffles,
wow-wows. And they're so colorful.
Yeah.
The same color you're seeing on the snack is the same color that is going on top of your teeth. Okay. So you are probably going to see that the teeth is going to change color because of exposure to that. But that is an extrinsic stain. So that is a stain that has just deposited on the tooth surface and therefore it can be cleaned off. Something to note is this stain removal does not involve removal of the enamel. Enamel has to stay on the tooth. So when you're having cleaning done, no enamel reduction is being done. There's also been that whole conspiracy that when you go for cleaning, they damage your enamel. Whatever we use for cleaning cannot cut your enamel. We've said enamel is the hardest structure in your body. So the cleaning devices cannot do that. Extrinsic stains can be managed by professional cleaning, and there are also some things that we can recommend on a patient-to-patient basis for you to use that are safe to protect you from the stains. So that's the staining part. Now, a healthy tooth. A healthy tooth is basically a tooth that has sound tissues, okay? And sound tissues is the whole array. The hard tissues and the soft tissues as well.
The soft tissues being your gums.
The gums, exactly. So the gums and your tongue as well, muscles, your cheeks, everything needs to be healthy. Your lips. When you come to the dentist, we are not just looking at your teeth. I think there's also that thing, Dr. Riwameno.
Yeah.
But we're also looking at everything inside your mouth. You come in for checkup, I'm going to be checking, is your tongue healthy? Because some people develop oral squamous carcinoma. That's cancer that affects the mouth. Very early, it's easy to treat because we are able to just, cut it out and you heal and we do the therapy.
Cut the
area that is developing the cancer. And it normally starts as a small ulceration. I think many people don't know about it because they assume, I have a kidonda, it'll go away. It's been 3 months, the kidonda is still there. In fact, it is getting bigger. You're not able to eat, you're not able to do anything. You're probably developing cancer in your oral cavity and you don't know. So you come in for checkup, it's our responsibility to also educate you on how to do a self-assessment at home. Check your tongue, check your gums, no ulcerations. If you have anything beyond 7 days that is just persistent, that's bad, okay? So we are saying they have to be sound. Let me go to the one that now people really like, the teeth.
Yes.
So when we talk about soundness of the teeth, it means that the teeth are not having cavitations. I think this is a good demo where you can see. And a cavity doesn't start suddenly. It starts very tiny and then it grows and becomes really big. And now that's when it becomes painful and that's when we get patients, unfortunately. We are hoping that more people come to us to do more preventive measures rather than curative measures. So your enamel does not need to have any holes, and a cavity is not, like decay is not necessarily a cavity. I'm gonna show you how this looks like on the inside. Sometimes a tooth could be whole, but decay has progressed on the inside, or it's somewhere here on the side where you cannot see. So this tooth is basically here next to this other one. It is developing a cavity, but you're not able to see it. So how are you able to tell? Once it becomes very big, because how are you able to tell there's something here?
Yeah.
You literally can never know. This is the importance of a checkup. Decay can be picked out on X-ray. Also, a clinician is able to tell. When we look at your teeth, we know how normal enamel looks like and how abnormal enamel looks like, okay? So that's the teeth. Also, your teeth should not be shaking. I know people imagine that when you grow old, your teeth should start shaking. That's not something that is normal. So we need healthy tooth structure and we need stability. That's a healthy tooth.
An unhealthy tooth?
An unhealthy tooth is shaking and the tooth structure is diseased. Diseased can be a cavity. It can be maybe the enamel has been scratched off. I think you've heard of people saying that I was brushing too hard and then I got a cavity. So there are also cavities that are formed on the teeth as a result of abrasion or that very, let me just demonstrate the brushing technique that people really like to, very rough scrubbing. The correct one is more of a circular motion and very gently, okay? So we want your teeth to be free of these things. And also the soft tissues, healthy, not bleeding. Bleeding gums is it means your gum is not healthy. So if you notice there's bleeding, that's also a challenge.
You know, you just mentioned something that many would wonder because I am brushing my teeth, right? Because I believe that is a way of me taking care of it. But what you're gathering now is that even how you brush your teeth can expose you to having cavities because of abrasion. So then what would be the perfect fit for brush that you use? Are we seeing that we have brushes that are tough to the enamel and stuff like that? And how, as a layman, I'm walking into a store and I want to get a toothbrush. How do I know which is best? Because
you never know.
How do I know? You just never know.
Never
You just never know. Then there is a huge array of toothbrushes.
So
do we have, like in terms of stars, 5-star, this one's very best, like we have a single star, or it's just God save us all?
I'd say every patient's treatment needs are different, but on average, we want every patient to be using a medium bristle toothbrush. How can you tell that a brush is medium bristle? When you pass your thumb on the bristles, they should be able to bend. Very gentle pressure, they should be able to bend. Because sometimes people package and they write medium bristles, but when you try to bend, they are not bending at all. So that's one thing. Medium bristles should be very soft. Just pass your thumb on them. It should feel soft. When you pass it also on your skin, you shouldn't feel like you're being scratched. It should feel like it's just rubbing on your skin. So you can make a good decision like that. But as I said, every patient is very different because I could meet maybe a patient who is a smoker and very heavily exposed to nicotine and tobacco, and their teeth are getting very stained. And the quality of their enamel is good. Such kinds of patients would probably need a toothbrush that is a bit tougher so that we are able to manage the stains. So it's on a patient basis, honestly, but everybody should stay away from those very rough brushes. Those ones are not helping anybody. And the technique is less scrubbing, more circular
motions. You see, we're here talking about matters to do with your oral health, you know, and how you get to protect your enamel. A lot of information we're getting here, but let's take this short commercial break. When we come back, we look at health-seeking behaviors, especially when it comes to oral health. Don't go too far. We'll be back with much more. And thank you for watching. Welcome back. This is Health and Wellness. We continue with conversations around oral health and how you can take care of that. Dr. Kendi.
Yes.
On the break, we've just looked at different kinds of issues that we have in our teeth. But I want us to look at our health-seeking behavior, especially when it comes to oral health, right? We're told at least to visit a dentist once or twice a year. Are we?
No. Unfortunately, we are not. We are not.
How does it look?
Well, there's a bunch of people who are really trying. I'd say that for sure, because we cannot condemn everybody and put them in the same basket. But I think we have a challenge, especially with accessibility, especially in the remote areas. So again, it's a matter of policy, where at least healthcare institutions need to have a dentist, because most of the institutions, mashinani, people don't have dentists, so they're trying to access healthcare, oral healthcare, and there's no one there. Also, the attitude that we have with our population, it's not so good, because maybe most people imagine that dental care is for the rich.
Okay.
But everybody is entitled to good oral health care. It's part of your body. You cannot just assume it. So we are getting most people coming in at the very later stages, just when there's pain, as I've told you. People wait for pain, and we're really trying to move away from that. So we are getting, we are really trying to do like what you're doing here, raise awareness so that people can understand the importance of coming in early. Every 6 months is ideal, because 6 months is the time that your body can actually change and things can, progress. That's when we see a difference in terms of disease progression. So that's why we always say 6 months. Every 6 months, just come for checkup. At this point, we are able to do cleaning for you. If you have any challenge, we're able to let you know early, in good time. Yeah, but I'd say we are not yet there.
How is oral health-seeking behavior, especially when it comes to children? Why do I say that? Because a parent pretty much, a human being pretty much is supposed to see a dentist when the first tooth shows up.
Yes.
That very first tooth. Because
So glad you know that. I'm so happy. Yeah.
But that's usually not the case.
Yeah.
You find that even parents, the first time that they take a child for checkup is when the child is in pain. When the child cannot sleep at night. I'm saying this because the first time I went to a dentist is because I couldn't sleep at night, and these then tends to expose individuals, because you find teeth are not growing well. We have gum issues. You have a tooth that is growing inside the other, but these are things that could have picked at the very onset when these teeth were starting to show up, even just the structure of the teeth.
Very true.
But leave alone adults, because adults now that you've just decided not to. But let's talk about a parent taking the responsibility. The first tooth has shown up, or two, let's say four. The first 4 teeth have shown up. Are we seeing more parents bringing babies to dentists for that service? And what does that mean to this child when they grow if they don't see the doctor?
I'm so happy you know about the first tooth thing, because not many people do. The World Health Organization actually recommended that, because they said that a child needs to establish a dental home. What is a dental home? A dental home is a place where a child feels safe, where they are educated on proper oral health habits, and their growth is monitored so that we prevent any issues that really are related to oral health. So it means, as a family, you need to have a place where you are all going for treatment. Okay? This helps the child pick up those very good habits early. I'd say I am seeing an improvement, but we have a long way to go. We have an extremely long way to go. There's this thing of dental phobia, I think, that has affected many generations, and we're still trying to get them out of it because of that thing of just going to the dentist when there's pain. So you are associating the dentist with pain.
With pain.
Yeah. Imagine if we all had really good experiences at the dentist. We would probably be enjoying to go there. It should be sort of like a spa treatment for your teeth. Yeah. So we are seeing more parents, especially the more woke ones, bringing their children very early, asking what kind of toothpaste should I use, teach the child how to brush. And we are very elated about that. But we have a long way to go. Yeah.
Doc, if you consume TikTok, You see, we have all kind of regimen out there.
Yeah.
You need to use apple cider vinegar with baking soda, a little bit of salt, and some lukewarm water that will help your teeth get whiter and all this. Break that information down, because based off information that I have, that actually destroys the tooth.
Yeah.
But let me hear it from the doctor.
Yeah.
Because having this conversation peer to peer, many people don't take that as fact. Am I wrong in saying that you're actually destroying your tooth by using this?
Yes, you are. You're very right. No, you're not wrong. You're right about the distraction, because the regimen is basically a very acidic regimen. The very acidic regimen is, again, encouraging tooth wear in form of erosion.
Okay.
When your teeth are exposed to that kind of pH, that low pH, that acidic pH, what happens is the enamel starts eroding, which is not a good thing. People are doing that because they're upgrading the enamel. Remember, the enamel can attract stains. So people are finding it appealing because once you apply that substance, a little micro layer of the enamel that is stained goes away. Instead of going through the correct channel to deal with the staining, people are taking that route. So it's not right. I think there are so many regimens I've seen online. I've even seen people using like the charcoal directly. And I have talked about it severally, especially on my TikTok page, that it's not safe. This charcoal that is incorporated in toothpaste has been treated. It has gone through some sort of work to be safe for your teeth. And the toothpaste also has ingredients to kind of counteract some of the damaging or deleterious effects of the charcoal. So you cannot just go and just crush charcoal and use it. You have to read the science behind it.
Yeah.
You have to, and this in-person visits to the dentist, it helps because every individual has a wide variety of information. Every single day I'm at my office, I hear different regimens. I hear different solutions. I learn different things every day. There's so much knowledge out there that people are consuming that I think we can only work on individual basis. Like, come and tell me that this is what you've had. Is it right? Then I can explain to you that, you know, this, don't use this, don't use that because of this and this. Yeah, so let's get the facts right. Yeah, chat with your doctor.
You know, it's not me saying, it's the doctor saying, if you want to use charcoal, choma nyama na makaa. But when it comes to using on your teeth, just buy a charcoal that is treated. But Daktari, as well, of late there has been a frenzy out there. We're seeing each and every single person with braces, and there are two conversations happening. There are those who genuinely want it because it's helping. But there is also talk that that's the new thing on the block right now. If you want to look pretty, braces is the way to go. If you want to look like you're moneyed, braces is the way to go. What informs one having braces on their teeth?
Okay.
Is it a status symbol?
Rumors. It is not a status symbol. But yeah, I've heard about that as well. I've also had people saying there's beauty braces, and I don't understand the concept. But I've also watched videos of people saying how badly damaged their teeth have become or their gums have become after getting these braces. Now, braces are a sort of orthodontic treatment. Orthodontic treatment is when we are trying to align your teeth, okay? So it's a treatment that should be offered by a qualified person. It should not be offered in the beauty centers. People have no idea what is happening. A dentist might seem to be doing something so easy in your eye, but there's a lot of thought that goes behind it, okay? When we put braces, this is like a model that has braces. These things are literally attached on your teeth. This portion with the bracket, this is called a bracket, it doesn't get any fluoride. So when you're brushing, that area has been blocked out. Also, because of all of these things in your mouth, food retention is very high. So it means brushing is extremely difficult. There are people who benefit from braces, and we always walk the journey with them and educate them on how to take care of the braces, how to make sure everything is working well. But braces is not a symbol of beauty or trend or whatever. This is a treatment. It's a treatment. It's like saying you can walk into a pharmacy and buy a drug and just drink because it's cool. It's not cool. It's treatment. So yeah, we need to raise awareness that it's not cool.
So we need to tell the public out there that when you see someone with braces, that person is treating a condition.
Anatibiwa aki.
Anatibiwa. Yeah. Ni patient.
Ni patient.
Patient 001.
Ni patient aki. Si ati anataka kukaa vizuri or anything. That's the option, or that's the modality of treatment that has been recommended for that particular patient. Yeah. So it's not that they are doing it for fun.
Yeah.
They're undergoing treatment.
All right.
Yeah.
Daktari.
Yeah.
After every meal, you need to brush.
Yes.
There's someone I talked to who said, and even if you find yourself in a position where you're unable to brush, take water and just clean your mouth and spit it out. It's very difficult, Daktari, for especially people who are working to find themselves walking with their toothbrush and toothpaste to work. 8 to 5, very difficult.
Yeah.
Whilst it is recommended, walk us through it. I don't want you to give recommendations. You are the doctor. Walk us through it.
Let me walk you through it. So what we normally say is that we have like a rule of 2s.
Okay.
Okay. So we want you to be brushing at least twice a day. It doesn't have to be after every meal.
Okay.
Because 2 times is adequate.
Adequate.
Just after breakfast if you can, and just before going to bed. The nighttime brushing is the most important one. And I think that's the one people ignore, because I think there's that thing of it, if you want to keep your friends, something. So people are brushing in the morning because they're like, I don't want my breath to smell bad. But what about the health of your teeth? Because at night, you ate all the mandazi
your
and
breath
whatnot.
is smelling at night with your ancestors.
It's terrible. The bacteria, they're just having a party in your mouth. And that's when cavities are forming. So you have to make sure, because at night the salivary flow is not so much, you have to brush immediately. I always tell all my patients, you brush, and after that, don't think about anything. Go to bed. Okay. If you want to, just take water. But that one is the most important. So 2 times brushing. 2 minutes brushing. Take your time to brush. When you're brushing, we've talked about the surfaces already. So we have the outer surfaces of the teeth, the chewing surfaces, and the surfaces near the palate. The palate is this upper part, and the surface near your tongue. Most people forget to brush those areas. Yeah. Okay. So it's more of circular motion outside, scrubbing here on the top. On the top, we allow you to scrub. You can scrub. Please scrub. And then on the inside, you do more of like a sweep near the tongue and also the palate. And then you remember also to brush your tongue. You can either use a toothbrush to clean your tongue, or you can use something called a tongue cleaner. A tongue cleaner looks like it looks like this. Okay. So it basically just scrapes off the dirt from the tongue surface. But your toothbrush could still do that job. So 2 times brushing, 2 minutes of brushing. And then we want you to visit your dentist 2 times a year. Okay. When you're doing your toothbrush after every 3 months, you should change it. But an indicator would be how the bristles look like. When you notice the bristles are fraying means that they've started bending. Now your toothbrush looks like immature. Yeah, they are just over there. You need to change your brush at that point. Yeah. So make sure you're using a good toothbrush, good technique, and a good amount of toothpaste. I think we always educate patients on how to dispense your toothpaste and how to select your toothpaste.
Wait.
Stop there.
Wait. How do I dispense my toothpaste?
Hi.
Because I tell you what, I have a problem. Okay, it's just a problem that someone will dispense toothbrush from the middle, yet it's full. I'm like, who raised you? But anyway, how do you dispense?
How do you
and
dispense?
How much?
Actually, let's do this test.
Yeah.
Let me give you this toothbrush, and then just show me how your normal amount of toothpaste.
I'm the one who's on the spot. Oh my Lord.
You are the example. You are the sample population.
So, okay, I start from the... From
that
below.
part is important.
Yes. Okay.
Let's see. Is it open? If it's not,
I just do kidogo.
This guy's woke.
Clock it.
Oh, Peter Mtihani. Peter. Yeah, so that's the correct amount, actually. And for children, it should just be like a smear, literally, just a smear on the toothbrush. This basically means you're getting enough fluoride on your teeth. We talked about fluorosis earlier. That's an issue with fluoride inside the teeth. Then we need fluoride on the teeth. So even people with fluorosis, I think they find it's like a whole quagmire. Like, why are you putting more fluoride? Like, the inside fluoride is the issue, but the on top one is very important. So we're always recommending toothpastes that contain fluoride, especially for patients who are exposing themselves to sugar and all of that.
Yeah.
But in terms of amount, I am glad. There's no need to dispense a whole line.
Yeah.
That's just wasting.
Uchumi peko juu sana.
Uchumi nini. Just put that's a pea size, that's enough. I'm glad.
Right.
That's the correct amount.
So that's the correct amount.
That's the correct amount.
Okay.
Yeah.
And then we find that we also don't scrape our tongue. Because personally, I scrape it because using the brush, I feel like I'm gagging, you know? So which is the best or can either serve the purpose? And how important is it then for everybody to start cleaning their tongue as well? Because I mean, ni men on a brush. I need to brush my tongue. How critical is it? How important is it in just making sure that you're taking care of your overall oral health?
Okay. So your tongue, it's important to keep it clean because your tongue has taste buds. These taste buds basically have food reservoirs that remain there. If you forget to clean your tongue, you're encouraging halitosis or bad breath.
Okay, halitosis is bad breath.
It's bad breath.
Okay.
So you brushing your teeth and not cleaning your tongue means you still have little food particles somewhere. You might not see them, but your tongue has many, many taste buds. The best one is normally the scraper because it has been designed to do that. Most toothbrushes also in the market have a place at the back where they have a tongue cleaner. Okay. If you don't have that, you can clean using the brush. You don't have to like go in so far. Okay. Like, I don't know why people do the thing
where the tongue goes that far.
Yeah, no, but just like do at 2/3. 2/3 is adequate.
Okay.
Just make sure you clean, and it's a gentle brush. If you're also finding all this irritating, you can actually wipe your tongue.
Okay.
Yeah, even for babies. So you can get something like, things like these are available in the market. They're called oral cleansers. So this is basically just gauze that has been attached somewhere. It comes in packs because of sterility, so it's very clean. So you can just use this and pass it on your tongue, just wiping.
How do we clean our tongue?
How do we clean it?
Because there is, so when I'm brushing my teeth, it's a circular motion, right?
Yes.
Right? And when it's on the surface of the teeth, I just scrape it.
Scrub it.
When I get to the tongue, is it circular? Am I removing it out?
Sweeping.
Nikufagia.
Yeah, so the same design, you kind of want to imitate your tongue scraper.
Okay.
So what your tongue scraper would be doing, it's like a windscreen kind of thingy, yeah? It's a windscreen. Okay, I'm bad with cars. It's the thingy, the wipers. Wipers.
Yeah.
So the wipers, the way they clean the windscreen is the same way your tongue needs to be cleaned.
Okay.
So you're going at the back and kind of pushing to the front. So if you're using a brush, same technique. From the back, pushing to the front. If you're using the oral cleanser, same. Kwanza for babies, it's important. You know, when they are breastfeeding, that time when the first tooth is coming, most parents think it's not important. But that's when you're building tolerance for the child. You'll find a parent saying that my child doesn't like brushing. It's because you did not introduce brushing early. Once the child just is breastfeeding, buy the oral cleansers. At night, before that time that they do their long nap, take your cleanser and just pass it on their tongue, pass it on their cheeks, and they'll get used to feeling like something has to go in their mouth to clean it. Yeah? But for the tongue, we're always back to front, sweeping.
All right.
Yeah.
Dr. So we've talked about all this. I want us to briefly talk about policy. I know that's another whole conversation, right? But because we're running short of time, I just want you to talk to us about policy and how that then would inform even our households where we live, the water that we drink, what we use to cook for, that is enshrined in policy so that even in these houses that we move into, from the word-go, from the onset, they are set up to protect you wholesomely.
So right now, the policies that are in place in terms of water safety, they only affect the bigger, like the counties, you know, the ones that are providing the water majorly. Like Nairobi, water is safe. But there's actually a time we did a study in Nakuru County. There was a time Nakuru County was being notorious. The water was not safe. But most counties now have adhered to that, and their main supply is safe. But now the boreholes, that's where we need to go. So I think the government or the health people in charge of developing these policies, it now needs to go down to that level, where now the people who are constructing these houses need to be aware that they are responsible for the safety. If you're sinking a borehole, if you're being given a permit, you have to be told that this water has to be safe. And it is your responsibility to make sure it is safe.
Yeah.
So as you're moving into an apartment, my proposal is, and I think I'm still pushing policy and all of that, there needs to be like, you see where there are certificates for health, like when you set up an institution and they come and inspect, people need to inspect these premises. Safety includes water safety as well. As you're checking for structural durability and all of that, include that small portion there. Give me the water, let me test it. Is it safe? That is part of your safety checklist. Yeah?
All right.
So that's the policy in terms of safety for the water.
All right. Dr. I want to come to your sport, right? I want to come to your clinic. Where do I find you? Where's your clinic at? TikTok tunapatana aje? Can I slide in the DM to book myself a day?
Yeah. All right. So, of course, online, I'm very much available. My name is Dr. Kendi, and that's my username on all platforms, Instagram, TikTok, Dr_Kendi_KE. I am a general dentist, and I have a private practice in Westlands. It's called Enamel Elegance. It's an amazing place, opposite Safaricom. So that's where I do most of my work. We have also a wide range of specialists there. So if you want to reach me, that's where you can get me at Enamel Elegance and Dr_Kendi_KE, Instagram, TikTok, Facebook, everywhere. Yeah.
If you're to tell Kenyans who are watching right now two things about their oral health, what would that be?
You've really pushed me. I squeezed them to two.
Yeah.
Okay. Your oral health affects your overall well-being.
Okay.
It should not be taken for granted. Okay. The next thing, please love your oral health. Treasure it. Don't take it for granted. Yeah. Those are the two things I would tell them.
You see, that right there is why health and wellness exists. Because we're here not only to just tell you about the disease, but as well to tell you how to take care of yourself, take care of your oral health in this case. And while we're talking about it, remember, we've equally just said, Bana, uchumi ni mbaya, but this is the amount that you deserve. But most importantly is to visit the dentist who will give you the solutions that you do deserve. My name is Dennis Aseto. Asante sana Daktari, Dr. Kendi, as well as just taking us through everything else. And like we keep on saying, your health is your wealth. Your dental and oral health is your overall well-being. Sounds nice. See you again.